Good evening and welcome to Moving Forward, a production of the Bay and Grantstown Advancement Association. My name is Reverend C.B. Moss. I'm your host. This program is primarily committed to identifying obstacles to the advancement of our nation. And with the help of all of you, including our in-studio guests, we seek to address these challenges and hopefully, if not eliminate them, certainly reduce them, that our nation could progress. It is often said that the health of a nation is the wealth of a nation. And now, unfortunately, our nation is being besieged by a number of rather serious health concerns. We are speaking specifically of very contagious diseases that include scabies, chikungunya, measles now, swine flu, and all of the others. And the truth is, they are very serious, and particularly to the Bahamas, as we are so open. We have very open borders. And we have large numbers of visitors coming in and out. And so we must be constantly alert, because it takes only one contaminated person to contaminate the whole country. And so we are delighted this evening to have two very special guests to talk about what has been going on in the community of Bay and Grantstown, because we feel that when it comes to health issues and the response to these issues, that we in Bay and Grantstown tend to lead the way, because we are so blessed with very dedicated personnel, both voluntary and otherwise. And we've got two of them in the studio with us this evening, and you've met them before. They've been with us before. And we speak of Nurse Larry Miller Ferguson, who is the Director of Community Health for the Bay and Grantstown Advancement Association, and Mr. Winston Sweeting, the Director of Environmental Health for the Bay and Grantstown Advancement Association. And so between them both, they cover all aspects of health, human and environmental, and they've done yeoman's work over the past several years. Let's welcome them. Nurse Miller Ferguson, Mr. Sweeting, welcome to Moving Forward. You've been here before, but I think the seriousness of the present situation has brought you back. And we don't feel the need to go in depth into who you are and what you're doing, because we've done that before. But Nurse Ferguson was appointed, I think, November of 2014. Yes. 2014 as the director, because she basically retired from the government service, and she was too young to go into hibernation. She had too much information. After 40 years in the health services of the Bahamas, we felt we just could not allow her to just take that and go into the dark shadows. So we encouraged her to come on board, and since then, man, she's been fantastic. Then, of course, Winston. Winston is a former employee also of the government services, having been with the Department of Environmental Health for what, some 40 years? 40 plus. Retiring as the Senior Deputy Director. And again, too young to just sit down and, you know, watch his money grow in retirement. And he has too much knowledge to just have him sit around, so we invited him to become a part of our dynamic team, and he has agreed and has been with us for a couple of years now, again doing great work. So because they are so closely related in their functioning, they're always together. So welcome once again. Nurse, we have some problems. In 2015, I think, our community was hit by the scabies scare, to which you responded valiantly, and thank God that was not so serious, even though these things never go away entirely. Then, of course, we had the chikungunya and all the others, and we heard about dengue in Jamaica. And Jamaica is a stone's throw away, as a matter of fact, when it comes to, you know, transmitting that here, because you only take the visit of one infected person. So you began to mobilize the team once you heard that. And then when we heard that measles was rampant in a part of the United States and we were threatened, you all decided to get to work. So thank you for that. And what have you done recently? I know last month on the 22nd, you all had a neighborhood visit. Tell us about that.
Okay, myself and another member, two other members of the team, we just mobilized forces and decided to go throughout the community of Baintown, alerting our residents and just checking immunization cards and encouraging adults and children alike, adults to ensure that their children were immunized. Fortunately for us, our finding was through all of the cards we went through and people we talked to, the children, most of them in the Baintown community that we saw, were relatively up to date, which made me feel really very good. Now our adults, we spoke to a number of our adults and encouraged them to go out to be immunized, informing them that immunization was not only for children. So hopefully, I think by now, immunization should have been started at the clinics. And I encouraged them to listen, and once the announcements were made, to go out and ensure that they were immunized against the various threats with immunizations that were available. And during that time, with the walkabout, we not only found, not only looked at immunization and that we talk about scabies, we talk about a number of other health threats and health conditions that we found at the time, including some ringworm and a number of things we found in school-age children that we were able to give advice and refer persons to the various health clinics. So it was really a very good walkabout, and we plan to continue to keep our population up to date.
Well, I am extremely proud of the work that you all have done, because Winston, going back to the Zika scare, this would have been 2016, 17, the Environmental Health Committee was very active, along with, of course, a couple of government agencies, Department of Health and the Department of Environmental Health. What did you all do in that regard?
In that regard, we visited a number of homes in the Baintown, Grandstown area. I think the environmental health is still visiting and doing surveys with regards to Zika virus, dengue fever, and the lot, other diseases caused by mosquitoes. And in our visit, we encouraged people to dispose of their household refuse correctly to prevent mosquito breeding. Any settled water in any paint cans or other cans or old car tires, we ask them to discard them and put them out for collection by the solid waste collectors.
That was a very successful initiative, because we worked along with the Department of Environmental Health. Ms. Melanie McKenzie, she attended one of our meetings with her people. You know them.
Yeah, I wouldn't like to forget about the Vector Control Department. They played an integral part in the investigation.
Yes.
In dengue fever.
Well,
and Zika virus.
We appreciate what the Department of Health, Environmental Health, and others are doing. But we have just decided we are going to help ourselves.
Right.
And while we work along with them often, but we are on the ground.
We were there before they came in initially.
Right.
We were there. They may have passed around years ago, but not as frequent as Baintown Grandstown Association did.
Yes.
And we visit each home and we sat and talk with people about their environment and what we expect them to do. Yeah. And then we invited Environmental Health to come along, and they were more than pleased to come along.
Yes.
We had several meetings, and the director sent our staff, and they came.
Well, one of the benefits to residents participating in events like this, it gives a greater level of comfort to the other residents.
Right.
You may recall when the government agencies initially went out in response to the Zika problem, they met with some resistance. People were not, as receptive, because sometimes other things get in the way.
Right.
But once Larry Miller, yourself, and others went out, as a matter of fact, you may recall, we placed an ad on the radio saying that, we are involved and that the residents should cooperate. that just eased everything. So we are speaking to other communities also. Residents know their neighbors. When their neighbors are involved, they feel more comfortable. They open up, they share more, and they work along with these neighbors. So we want to encourage other communities to get with it, because we cannot just rely on the government. Who knows these communities better than anybody else? Right. The local people.
One of the things that we did with the community is when we visited, we encouraged them to know the different diseases and also to know the symptoms. So if they or their children come up with these symptoms, they would go to the clinic and let the nurse know. You know, so that was one of the main things that we did. I don't recall any Zika outbreak being down in Baytown.
Not an hour,
No, I don't.
And we would like to keep
I mean, the potential is still there.
Right,
But
of course,
you know.
Because I think it has to be ongoing, because you go in and you talk about the threats and you get people interested and alert them. But when you go back again, sometimes you see some of the same things, because this past week we saw some of the same things that we talked about previously, and I'm sure was cleared up, but then people, you have to be continuously at them to ensure, to protect them against themselves most of the time.
Excellent. And of course, we leave a lot of printed material.
Right.
That's very important, because sometimes they may not fully understand, you know, the communications, the verbal communications at the time. But once they have had time to pick up that pamphlet and read, that could help them. So also, if persons in the community are interested in getting some of this material, you may contact Nurse Ferguson or call the office 328-8984, and we'll be delighted to have this material drop by your home, because it is very important to keep our community as healthy as is possible. In that regard, whenever I think of the health fairs that were conducted over the last 4 years, I am so excited. I think it was in November of 2015, the first health fair. Tell us about that.
Okay, that was the first health fair. It was most encouraging in that we were on the park just opposite the church on Meadow Street. And what was so encouraging, we had other nurses who came out. We work in collaboration, and also some of our physicians who came out to assist us. And we, at that time, did health screening, where we did weight, blood pressure testing, testing for glucose, for diabetes, that type of thing. And persons were very, very, very receptive. And we had more than 100 persons show up in that 4-hour time, listening, asking questions. And of that group, we had a few referrals, because we found some pretty abnormal blood pressures and blood sugars. So we gave them referrals to go to the various clinics so that they could be seen. We had a subsequent health fair, and hopefully we're looking forward to another health fair by April, the end of April this year. Something bigger and better than we've had before.
So that was the first one in November of 2015.
Yes.
The second one was November of 2016.
And
this one occurred in Grantstown off East Street. How was that?
That one we felt was not as well received as the one in Bainstown. We had a good number of persons show up who were able to give information and do health screening, but not by any way as encouraging as it was in the Baintown district.
And we had another one which we're going to discuss when we come back from this quick break. So folks, don't go away. We're going to be right back with our guests, Winston Sweeting and Nurse Larry Ferguson.
Only love can save us now.